Hello and welcome to another episode of the Help Is Here podcast brought to you by the Beyond Compulsion Academy. My name's Thomas Molyneux. I was in porn addiction for around 10 years, and here we have Mary Paulus as well, who's worked in addiction recovery for around 30 to 35 years as well, or even longer. Anyway, how are you doing today, Mary?
I'm doing good. Yeah. How are you?
Yeah, not too bad, thank you. So in today's episode, we're going to be talking about this question, is addiction a disease? So Mary, let's just get straight into it. Like, do you think addiction is a disease?
Well, if you break down the word dis-ease, yeah, well, you're going to be in dis-ease if you're in an addiction. You're not going to feel at ease, that's for sure, in any way, shape, or form. But when people think of disease, you think of something that happens to you, right? That is out of your control. I mean, when you think of diseases like cancer or whatever happens to you, this is beyond your control. And now, I everywhere I look, I see them calling addiction a disease. And I don't know, maybe it has something to do with the pharmaceutical companies. Like if they call it a disease, then doctors can prescribe medications and then the insurance companies will pay. I don't know what the motivation is, but I do know that if people that have addictions look at it as a disease, they're gonna just be like, well, this is just out of my control. This is
Mm.
not something I control because this is happening to me. I have this show that I love. It's called oh my God, I forgot the name of the show. We're gonna have to start over. Or you can cut
Let's
it out.
start the whole podcast again.
Heartland.
Yeah, this show.
It's Heartland. Anyway, so Heartland is the Canadian horse show. I'm like, it's been a while since I watched it. It's over, but so they have this guy's he dies and his mom is going to come to his funeral or a celebration of life or whatever, and she doesn't come because and they don't know why she didn't come, and then later on she's like, well, I had relapsed into my addiction or whatever. And then one of the other, like the daughter or the wife of the guy who dies is like, well, we have to like forgive her because addiction is a disease and that was out of her control, and it's like, it's everywhere that addiction is a disease. And really, if you look at it that way, it's not helping. And like I said, maybe there's some motivation by pharmaceutical companies or something that we don't understand or we don't know about that they would be wanting to call it a disease. But for someone who is struggling with an addiction, it's not helpful at all. It's detrimental. And the other thing is, like, if you look at it like this, I mean, they're starting to call, obesity a disease, which of course comes from food compulsion, which so now is the food compulsion a disease? This is something that happens in your mind. And then if we look at it like, okay, disease, like, okay, addiction, alcoholism, they definitely call that a disease, or different drug addictions. But let's look at porn addiction. It's an addiction. An addiction is something that you want to stop doing and you can't stop doing it and it's harming you, right? So would you call porn addiction a disease? It
Yeah,
doesn't
I
really make
mean,
sense, does it?
I think the main thing here is ultimately it comes down to the semantics and it's just a social construct, whether it's a disease or not a disease, it's just
Yeah.
somebody out there has collected these things together, these problems that people have, and have said either this is a disease or it's not a disease. And as you say, maybe the intention behind that is to make money and profit one way or another. But I think it's important to recognize that for a lot of people, and I would say myself included, and in fact, probably all the clients we've worked with, it's not their fault that they ended up getting temporarily hooked on porn, having addictive neural pathways. They got into that because they live in this world where it is normalized to watch porn and it can be highly addictive, and there was no real way of these people to get out of that. And then obviously the methods they've tried to quit, like the methods I tried to quit, weren't appropriate. They didn't actually change those addictive neural pathways. So yeah, maybe it's not someone's fault that they get into porn or they get any addiction to begin with. But I think calling it a disease, it just creates this idea that the person who then has the problem is completely powerless to changing it, like it's out of their
Right.
control to change it, which completely undermines the reality of the neuroplasticity side of things and the
Yeah. When's the
neuroscience.
last time somebody had a choice about their cancer?
Mm,
Oh, I'm just going to choose to not have cancer. It doesn't make any sense, you know?
yeah,
So, and it's what it's, not necessarily the phrase addiction is a disease. It's what it implies, or what people are how they're going to feel about what they're experiencing, and it's enough of a challenge to overcome an addiction but then you add that kind of thinking to it, well, I'm helpless against this. This is out of my control. This is something that's happening to me rather than something that I can change.
yeah.
It's not helpful.
I think
So
that's
yeah,
what a lot of problems come down to nowadays is whether it's actually helpful or unhelpful. And I think the world's become so obsessed with trying to categorize and stereotype and like put labels on things. So obviously we have like terms like ADHD nowadays and
yeah,
autism and neurodiverse and
yeah,
and different pronouns as well. And I know all about all of that because the company I work for talk that language. And a recent like meeting everyone was being asked like what are your pronouns and stuff, and I'm not going to say whether I really care particularly about pronouns or don't care about pronouns.
yeah,
It doesn't really bother me if someone wants to be called
yeah,
a certain pronoun. I'm not going to like go out of my way to not call them that pronoun. It's just I don't care basically.
yeah,
I'll do
same.
what makes someone feel comfortable. But the thing that I have noticed is that like the world nowadays is just so obsessed with trying to put people in these boxes, and I think in one way or another it's because it makes it easier to market things to them and sell drugs to them as well. And so I think
Yeah,
profit probably is at the heart of it. It also enables people to have this victim mindset and feel
yeah,
powerless, like they can't actually change their circumstances. And I just see this everywhere now throughout society is this feeling of powerlessness. Like there's these people with power but I'm not there. I don't have the money, so I'm powerless. But the reality is, I think people are so much more in control of their life than they think they are. But maybe when they're in an addiction, they do feel completely powerless because even in their own life, maybe they can't navigate the external world and change that and dictate how that works out for them. But even in their own mind, they're struggling to actually control themselves. And so obviously that's going to reinforce these feelings of powerlessness and helplessness. But then all the language around addiction and disease, for example, it just creates more helplessness, which actually perpetuates the problem even further.
yeah. Well, and I think that we can, talk about the profits and whatever, people are, I know people are motivated by money, but I have a hard time seeing people sitting around and going, how can we make people feel helpless around addiction so we can sell them drugs? I think it's more ignorance,
Yeah, I
people
agree.
don't know what to do with addiction. So they're just, throwing whatever they can at it. But and I think because they don't know how to treat it and help people to get better, now they're going to call it this disease or whatever. Or there's a lot of disorders now. There's like the American Society of Addiction, or I don't remember what it's called, but they're literally calling everything a disorder. There's nicotine use disorder. I mean, opiate use disorder. They're calling everything disorders, like where you can give it a name and or syndromes and disorders where it's like what came first, the symptoms or the name, because it's like they don't know what to do. It's like, here, this person has all these symptoms. So, or like metabolic syndrome is what they call people that are obese. Like, okay, so they have these characteristics, right, of like, okay, they're overweight, they have diabetes, they're this and they're that. And so now they call a metabolic syndrome. So now they have a medical, diagnoses that they can treat, rather than looking at the core of the problem, which is addiction. And thank God, when you have an addiction, you have a choice.
Mm,
But of course, the way addiction is treated, people don't feel like they have a choice.
yeah.
They feel out of control. They feel like I'm either going to be miserable doing this or miserable trying to stop. And they don't feel like they have a choice. So
Mm.
thank goodness. Yeah, go
Something
ahead.
else I've been thinking about quite a bit this week, just from having like calls with coaching clients and my own coach as well, is the people don't change until their desire to change is greater than their desire to stay the same. But I think a lot of treatment for addiction, this is getting a little bit on a sidetrack from, whether porn addiction is a disease or not. But I think a lot of people who are treating addiction, they want to ensure people feel really kind of comfortable and good all the time, like literally all the time though,
Yeah.
because they don't know how to deal with the addiction appropriately.
Treat
But
the symptoms. Yeah.
yeah, they treat the symptoms exactly. But I think people don't really change until their desire to change is greater than their desire to stay the same. And so if you're always feeling good, always feeling comfortable, which I think most people in an addiction try and do, is they're trying to deal with the symptoms, they're trying to feel good and stay in the addiction. It's like, okay, well, yeah, maybe you're going to feel better and continue in the behavior. But overall, like when you zoom out a bit, you're still living this lie. Like you're still
Well,
in the
there's a
addiction.
time limit. There's a time limit on that, That's the basic dilemma. You want to do it and you want to stop and you keep trying to run from it. That you can do that for a while. Well, I feel a little bit more comfortable because maybe I'm not doing it right now, but there's a time limit on that. That always, trying to deny one of those realities, wanting to do it or wanting to stop doing it when they're both true, that only can go for so long before it's like, you bust out of that dilemma and you engage with your addiction, with your addictive behavior. Sorry, I cut you off.
Yeah, no, I didn't really have too much more to say, but I think just, yeah, going back to like whether addiction is a disease or not, I think overall we're probably in agreement that what it comes down to is if you label something as a problem that you can't then change, then it's going to be a lot harder to change it. And I think that's what this all comes down to. It's just
Yeah,
understanding that actually you 100% can change these addictive neural pathways. These addictive neural pathways are temporary if you choose to
yeah,
change them. Like they can be changed, and so you don't want to have this like label on your head. And I think we have that with like a lot of people with like a victim mentality and other disorders as well that actually just can be changed.
yeah. You're not born with addiction. So how can it be, you know what I mean? It's like you're not born with it. And it's also not a life sentence. But, a lot of the treatments as well are going to be you're going to deal with this for life. You're always going to have, desires that you're going to have to deal with. You're going to have to go to meetings, for the rest of your life, whatever, rather than the neuroplasticity and changing the addicted pathways and being free of it. And
Hmm.
the thing is there's no real disease that you can change your thinking and overcome. I mean, thinking's powerful, but I mean, there's just some things that
Yeah.
you're not going to be able to just go, okay, I don't want this to be happening for me, and it stops.
Yeah, and I
So,
think language makes such a difference, and people often just use the incorrect language when it comes to addiction, and they use the wrong language when it comes to diseases as well. I mean, the amount of times I've heard people talk about cancer and how amazing it is that certain people have been able to like fight and battle their cancer, but it's like,
yeah,
is that really the right language? Because that actually is something which is very hard to deal with. And my mum has so many friends who do live with cancer because she set up a charity to help people who have cancer and secondary cancer in particular, which is when it's terminal cancer. And like the amount of friends of hers that have died or have got like really, really ill over the years, and it's like it's not their fault they've ended up with cancer and died of cancer. It's like it kind of, I don't know. I think for my mum and like the stories I've heard, it must be quite hard for people who feel like they've kind of been involved and it's their responsibility to like keep up this fight or battle with their cancer. And it's like, come on, like you can't really control that. So you can't have people saying, you know, amazing that you fought cancer and you battled cancer because that also means that the people who then die of cancer have lost the battle and they haven't like fought hard enough or some bullshit like
Yeah.
that. If my mum died, that just like really pissed me off, to be honest.
It did something wrong. Yeah. Yeah, my dad died of cancer, and they gave him some drug that was supposed to be like, oh, this miracle thing. And I feel like, he was going to die anyway, but I feel like it just made him much sicker,
Mm,
and yeah, it's like it was completely out of his control, it's like he can try and throw
mm,
these supposed miracle cures at it or whatever, but kind of back to this, you know, porn addiction as a disease. I think porn addiction is one of the best examples of looking at it like it is an addiction by definition, but it's how can you have a porn addiction disease? I mean, maybe they're calling things disease based on what's happening in your brain. So, but
mm.
it's still, it really, for me, the biggest point here is for the people that are dealing with the addiction. If they call it a disease, that's going to work totally against them. And we're doing everything we can to help people overcome addiction, and if we can eliminate incorrect language that's working against them, great. That
Yeah,
seems to be, for me, that's the point,
yeah,
is that disease feels out of your control, and addiction is not out of your control
yeah.
if you have the right tools.
Yeah, I mean, I've even thought about the word addiction quite a lot there as well. I mean,
Yeah,
I've seen loads of people say like porn addiction isn't a real addiction as well. And there's been like all kinds of kind of arguments in the sort of academic community around whether porn is actually an addiction or not. So I found that quite interesting. But
I'm going to look up the definition of addiction and just see what they say, like specifically on the Google,
I mean,
right?
I like how you put it as like a compulsion. I just prefer that terminology personally. And I think that's just because I've painted an idea in my mind of what an addict looks like, which is just
Yeah,
this bullshit stereotype, which, is just kind of being portrayed by society and loads of imaging over loads of
yeah,
years. But I think I definitely found it easier in the past to say like, no, you're not a porn addict. I mean, I hate that idea that just because you're living with temporarily addicted neural pathways, that makes you an addict. Because again, that seems
yeah,
to me very similar to kind of that disease-based model of like you have this thing that you're stuck with. I think that's what it
yeah,
comes down to. Is like I know it is all just like language and semantics, but ultimately what it does
yeah,
come down to is the temporary nature of addiction versus living with something permanently. And it's just
right.
such a distinction. So
These
really big.
addictive neural pathways, something that's happening to me right now. The definition is the fact or condition of being addicted to a particular substance, thing, or activity.
Mm,
He committed the theft to finance his drug addiction.
yeah.
So, it's just looking at it like, I mean, a condition, yeah, it's a condition, but it's a temporary condition. It's
Mm,
not a life sentence. I mean, it just implies that, you have this disease that you're going to be struggling with forever, that you don't, that it's not something that you can change, which you absolutely can change the neural pathways. And that's permanent change, yeah, it's not a band-aid. It's a solution. So, and I think too, one of the things we've been talking about lately is the discomfort of withdrawal. And I feel a little bit like we give people the impression that, it's going to be really uncomfortable. Yeah, there's discomfort in the withdrawal process, but with the methodology that we use, it's coming from a place where you can actually feel good about it. You literally can, I mean, especially by comparison, when you look at trying to outrun this thing or trying to control it or trying to substitute or distract or whatever else you're doing, going on streaks or whatever. It's so dramatically different that it actually does feel good. I mean, I don't want to give people like the false impression, like you're going to be like, yeah, this is so much fun, going through withdrawal. But, it really, by contrast, by comparison, it actually, you do feel good. And people sometimes are like, wow. I mean, I had one person say to me, it literally feels like the plug has been, like the addiction has been unplugged. Like,
Yeah.
like it feels so different, by
Yeah.
comparison. So yeah,
Well, I think
it's
it's the
uncomfortable, but don't be afraid of it.
just like the simplicity of it. I think
Yeah.
that's where people really struggle in a porn addiction is they just have all these different methods and routes and things they're trying to do, and often they're trying to control it, as you say. And maybe this is a episode in itself, but just talking about like controlling it versus being in control of it is such a big
Yeah.
distinction. Because I mean, you can do the no fap streaks and actually feel really good and confident for like a few weeks or a few months. But then
Yeah.
you end up engaging again, and it's like you're right back in it again, and you just feel absolutely terrible. And it's those ups and downs and that inconsistency and that lack of integrity and integration with the rest of the world
Yeah.
and all of that. It just feels
Yeah.
awful. Yeah.
I love that. I love that. Being in control of it versus trying to control it. We definitely should do a podcast on that, because it's so different, being
Mm.
you can feel like you're, in control temporarily, but I mean, bottom line is when you're in control of it, you don't have to be afraid of it, even if it happens, you happen to get a desire down the road or whatever, it's not anything you need to be afraid of, or don't need to think into the future like, oh my God, what if,
Yeah.
because if you have a desire, which you can get to the point where you don't even have desires, it's like it's not something to be afraid of, or like think you have this, you're branded for life as an addict that's always going to be struggling and trying to deal with it, or be susceptible to relapse. And
Yeah.
it's just not the case.
Absolutely. I think the final thing I'll say, just because I know we've talked about disease mostly, and then we've talked a little bit about addiction.
Yeah.
We've not talked about compulsivity, but again, that's fairly similar to addiction. So maybe we
Yeah.
cover that in a different podcast. But the one I do want to cover is habits as well. This is another word that people use all the time. And I think James Clear, in my opinion, has massively done people living with addictive neural pathways a disservice by talking about habits and almost downplaying the reality of addiction in his book Atomic Habits. It was a book that, if I'm honest, a few years ago, well, before meeting you, I was a huge, huge advocate for James Clear and Atomic Habits, one of my favorite self-improvement books. If you look online nowadays, it will come up as number one in self-improvement in like a load of lists for what's like the best book out there. And I think I was talking about this with a client the other day, or maybe it was a prospective client. But anyway, what we were saying is like brilliant, brilliant book for creating habits. Absolutely, go get that book. But when it comes to breaking habits, it's so bad because James talks about, as if I'm on first name basis with him, but yeah, James Clear talks about cue, craving, response, reward. And he talks about removing cues if you want to break your bad habits, but it just denies the reality that you're going to get triggered emotionally as well. It's not going to just be physical triggers. And also the addictive part of the mind will look for reasons, it will look for ways to create these triggers. That's just how addiction works when you're living with temporarily addicting neural pathways. Now, fortunately, all of that can be reversed and changed due to the neuroplasticity and thinking through the choice every time you have a trigger or you have this like cue where you feel the craving. So you got to think through that
Well,
craving.
I feel too like the word habit totally minimizes addiction.
Yeah.
I think of habits as like just annoying little things that you do here and there, not something that could totally destroys your life.
Mm.
I mean, addiction destroys people's lives. I mean, habits are kind of like, I don't know. I feel like it's just a very minimizing word. I feel like habit and addiction shouldn't be in the same room.
Yeah, I mean, to be fair
Yeah.
to him, like the author, I don't think he mentions addiction in the book. I can't remember. I might have
Yeah.
to read it again like a third time. But it was just like I was talking to a client and I was talking about breaking habits and Atomic Habits came up, and it turns out the client had also read the book once or twice. and he was saying he'd use those methods to try quit his addiction, and I was just explaining why that just wouldn't have worked at all. So if anyone has read Atomic Habits and they've still tried to quit this and have been unable to, I'm not surprised essentially. I just can't see how that book could help people quit addiction. But yeah, I'm going to read it again, I think, sometime and just kind of take some
Yeah,
notes and really try and figure out like
I'd be
where,
curious too.
yeah, I'm curious to read it again and just go, okay, yeah, so this is the information which I think is particularly detrimental. Maybe we do a podcast on it at some point in the future. But yeah, for
Yeah.
today, should we just wrap it up? Any final
Sure.
thoughts or words from you, Mary?
Yeah, I mean, just, for anyone out there who is listening and is struggling with an addiction, just know that you're going to hear all kinds of things that are going to imply that it's out of your control and that you're helpless. Whether you have a disease or you have a disorder or you have a syndrome or whatever it is, it's like, I think that people are really, genuinely trying to help, but they they're just like putting addiction in with just other sorts of problems, when it really needs its own very specific
Hmm.
method to deal with, so, you
Yeah,
know, people are trying to help, but it's when you hear that kind of stuff, just know that it's not going to help you if you're the person struggling with addiction,
yeah,
but help is here. So
yeah,
that's the good
absolutely.
news,
On
right?
that point, I did just create a new free training video. So we had quite a lot of people, I think around two or 300 people quite recently get the latest free training video, which was, it's the latest one, but it's probably about 6 to 12 months old. I've made a new one. It's about 7 minutes long. If anyone does want to go get that, it's at beyondcompulsionacademy.com. Totally free training. And the first sort of 4 or 5 minutes of it is just me explaining sort of what I tried in the past and why that didn't work and what I've done instead. So hopefully that will kind of guide you in the right direction towards the method that I use that has worked successfully. So yeah, go get that. Thanks a lot for watching or listening. Thanks a lot for watching or listening. And I hope you have an amazing rest of your day. Goodbye. Bye bye.